Welcome, everyone, to our summer Lunch and Learn series for New York City religious leaders on increasing our resilience to the climate crisis in New York City. My name is Lucy Cummings, and I am the Senior Manager of Faith Sector Resilience at New York Disaster Interface Services, or NYDIS, as we often refer to ourselves. NYDIS is a nonprofit faith federation, and it's made up of 60 religious bodies, about 2,000 faith-based organizations, and about 8,000 religious clergy and lay leaders. Together, we work with governmental and non-governmental organizations at the city, state, and federal levels who provide wraparound services around disaster readiness, response, and recovery to New York City. This summer Lunch and Learn series is about supporting New York City's faith sector to prepare for and build resilience to the climate emergency. So why are we focusing on climate resilience? Why is NYDIS, a disaster human services organization, focusing on climate resilience? Well, climate degradation is one of the main drivers of disasters in New York City and, of course, around the world. Whether we're talking about flooding or extreme heat, air quality, vector-borne diseases, or even climate migration, where we are seeing an increased influx of people seeking refuge in New York City, fleeing climate disasters from around the world. Climate is a threat multiplier. These hazards worsen economic and existing economic and health vulnerabilities. It's also a critical justice issue. This crisis has a disproportionate impact on disinvested communities in New York City, and that impact is especially hard on our communities of color, where houses of worship are on the front lines. And the severity of the climate crisis is not going away and is of course increasing. The more we delay developing adaptive strategies, the worse the impacts will be. So we are very grateful to FEMA, to Bricks and Mortals, and New York State VOAD for partnering with us on this series. And we are delighted to have Munerah Ahmed to lead our conversation today. She is New York City's Department of Health and Mental Hygiene's Climate Health Director, and she is joined by her colleague, Hannah Costello. And I have to say, we're going to be talking, as you know, we're going to be talking about the health impacts of the climate crisis in New York City with a focus on extreme heat. And given the extreme heat that we've been living with this summer and this past weekend, this topic is certainly very real to all of us. Our format is very simple. It's lunch and learn. It's meant to be conversational, informal, and we will have Munerah present, and then we'll open the floor for Q&A, and we will wrap up with an online poll, and that poll is super simple to fill out at the end of the presentation. So without further ado, let me pass this over to Munerah.
to understand when is the danger the greatest. And so these trigger alerts were actually based on research from our colleagues who saw that although in summer we see increasing harm with increasing heat, when the heat index reaches these levels, harm increases. We see a spike in death. So that's really the foundation of our heat advisories. And because of that, other cities and counties in the country are following similar suit to try to understand when is that danger the greatest and when should they start declaring emergencies. And so what happens in New York City when we declare an emergency? Well, we open hundreds of cooling centers across the city. If you know of people who need to access cooling centers, call 311 or visit the New York City Cooling Center Finder, which is only active during an extreme heat event. We also issue out notifications to notify NYC or Advanced Warning System. The Advanced Warning System is a great tool for organizations to get advanced knowledge of upcoming emergencies, as well as information, tips, and resources to help protect clients and contacts. We also have hundreds of outdoor cooling sites that have water features and shade trees that has been expanding every year as a way to escape that heat. Again, Cool It NYC to find outdoor sites to escape the heat. Cooling Center Finder to find indoor air-conditioned spaces to escape the heat. And so what do we know about heat? Well, on average, more than any other climate threat, on the extreme, heat is more deadly than any other extreme weather, more so than wildfires, hurricanes, blizzards. On average here in New York City and across the country, extreme heat is the most fatal. And in New York City, every year on average, we have about 350 people who die because somehow the heat impacted them. It could be directly through heat stroke, and we see about 10 New Yorkers die from heat stroke, and as well as heat exacerbating existing medical conditions. Now, what we find is that during extreme heat, about 100 people die because somehow that intense heat impacted a chronic heart condition, lung condition, kidney condition. But what we're also seeing outside of days like today, during regular summer heat, another 250 people died because somehow the heat exacerbated their existing chronic conditions. What we're also seeing are those impacts are not justly distributed. In fact, in New York City, because of the history of structural racism, Black New Yorkers are twice as likely to die from heat than white New Yorkers. And we'll talk more about how that is distributed among our communities. In addition to these fatalities, we also see about 450 emergency room visits during periods of extreme heat, as well as increases in hospital visits for lung, heart, and kidney disease. And one of the things that really drives that risk is that New York City homes are built for the winter. So when it becomes very hot, our homes become ovens. And in fact, the temperature indoor for many homes is about 10 to 20 degrees hotter. So today, when the temperature is expected to reach a high of 94 degrees, some homes, or many homes in New York City, are going to have indoor temperatures of about 110, 115 degrees. And how does that translate to heat, to health? So when we look at our heat stroke fatalities, we see that almost 70% of those fatalities occurred after people were exposed to heat in the home. And almost all of those did not have a working air conditioner. So that means two things: either there wasn't an air conditioner in the home, or there was an air conditioner and it was not in use. And it could be because of maintenance issues, because of cost issues. And so that's what we're seeing. Sadly, we've seen in some of those heat stroke fatalities that there were fans that were being used. When it gets hot, fans alone cannot offer protection. So that's why we say air conditioners are really lifesavers. And how can you recognize the signs of heat stroke in you or someone else? Well, the telltale sign, and this is the most concerning of all the heat-related illnesses, is hot, dry skin. Because think of it, during extreme heat or during very hot weather or even regular hot weather, the body's natural response is to sweat. When the body is dry and hot, it's an indication that the body is failing in its ability to stay safe. So when you see hot, dry skin, confusion, hallucinations, unconsciousness, unresponsiveness, nausea, vomiting, trouble breathing, rapid, strong pulse, or weakness and dizziness, get medical assistance immediately. Call 911 and follow their guidance. A second condition that is not as serious as heat stroke, but if left untreated, can quickly become heat stroke, is heat exhaustion. And what we're looking at is cool, moist skin, muscle cramps. When you see these symptoms, we encourage people to get someone to a cool space, give them water, and monitor them. The one thing that is important to keep in mind is that all of these conditions, all of these fatalities are preventable by getting people to a cool space and also making sure that people stay hydrated. And who's most at risk for heat illness? Well, it's two things. It's having an environmental risk factor and having a certain condition that increases your risk. The environmental risk factor is not having or using air conditioning. The personal conditions are having a chronic health conditions, such as heart, kidney, or lung disease, substance use conditions or excessive alcohol use, mental health problems, including but not limited to depression, anxiety, schizophrenia, having dementia or difficulty with self-care or cognitive impairment, where it makes it hard for a person to either feel the heat or communicate that they're hot, being socially or physically isolated, having limited mobility, or using certain medications that impact the body's ability to respond to heat. And we encourage people to talk to pharmacists if they're taking more than one medication to see if those medications may increase their risk for heat illness. And it's important to keep in mind that older adults are more likely to have a combination of these risk factors. So we really worry about older folks and want to really make sure they're able to stay safe. And earlier I was speaking about the inequitable impacts of heat vulnerabilities. Well, we're going to talk about the communal impacts. On the left is our heat vulnerability index, which measures how at risk residents of certain communities are for death during heat wave. The redder your neighborhood, the more at risk for heat-related deaths. What you will see about this map on the left is that it is remarkably similar to many other maps, including asthma distribution, diabetes distribution, job insecurity distribution. And again, this is really pointing out to what are the drivers of heat vulnerability. They're similar to many other things. Poverty, so not being able to have an income to provide. Green space makes a difference. The less green space, the higher the risk. Surface temperature, which is usually a reflection of concrete spaces or really impermeable surfaces. And what we see are the people who are feeling those impacts the greatest are our African American neighbors. And another thing that drives this vulnerability is lack of air conditioning, which is the map on the right. So you can see how those two really overlap. So again, it's really the socioeconomic, the planning of the city that really impact how people respond and feel heat. And as I mentioned before, air conditioning is the primary prevention. But we know we are a city of over 8 million people. And so how do we use air conditioning in a way that sustains our grid? So what we recommend is setting the air conditioner to 78 degrees or low cool. And it does one of several things. It helps people save money on their electrical bill. It also helps people conserve electricity and protect the grid, as well as it allows people to be comfortable. I have so many relatives who do not want to use air conditioning because they complain it makes them cold or it worsens their arthritis. And I usually say, well, Auntie, you have the air conditioner blasting at 60 degrees. You don't need to have it blasting at 60 degrees. You can bring it up. And so that way you could be comfortable and you could be safe and cool. And one of the other things to consider is that there are people in New York City who need air conditioning to live. And so how do we as a city responsibly use air conditioning? And so we really want to highlight that it is so important for our commercial and occupational spaces to use air conditioning responsibly as well. Because in helping to bring up their thermostat, they help to reduce the risk of power outages and the risk of someone succumbing because they were not able to stay cool at home. And what I want to talk about very quickly, unfortunately, this year, the program had so much need that it closed early, is the Home Energy Assistance Program. This is a federally funded program operated by the state and administered here locally by HRA. The Home Energy Assistance Program provides for a free air conditioner as well as a free installation of that air conditioner. Few changes happened in the last 3 years. This year, for the first time ever, a letter from a healthcare provider attesting to the need for an air conditioner was not required. And we think that is one reason why demand was so high, because that obstacle was no longer in place. In 2020, for the first time, people who lived in public housing and Section 8 or otherwise received some kind of housing or rental subsidy were finally able to access this program. Prior to 2020, they were excluded from this program. So we really are seeing wonderful changes as we try to achieve climate justice. It's very important that everyone who needs an air conditioner can access it. So while it's too late for this year, I want to put it on everyone's radar for next year. This program usually opens the first Monday in May, and ends in August, or when funds are depleted. This is a wonderful program. If you know people who meet income criteria and other criteria, have questions about it, I strongly encourage to look into it and help them to get air conditioning. The other thing that happened this year is that there are funds to help people cover the cost of electricity on their bills. They will be getting utility assistance. For most people, this is an automatic enrollment. They don't have to do anything. If they are in any one of these programs under the bullet that says automatic enrollment, they should already be getting some kind of break on their electricity bill. However, if people are receiving Medicaid, some type of federal public housing assistance like Section 8 or in public housing, if they are receiving veterans pension or survivor's benefit or Lifeline telephone service program, they qualify for this utility assistance, but they must enroll in it first. And we have spread the word that this enrollment period is open. We ask that you also spread the word that this is a utility assistance that's open to help people cover their electricity bills and their utility bills. And if they haven't already enrolled, please enroll. And so how do you enroll? These are the numbers for Con Edison and PSE&G to find out if people qualify and if they can enroll. And lastly, I know I'm a little over. Lucy, I promise I'm going to go quickly through these next slides. It's so important that we strengthen the bonds between neighbors and between institutions. I'm sure many of you are very familiar with the 1995 Chicago heat wave that killed about 750 people, mostly in low-income Black communities. That is the narrative many people are familiar with. But what is less known is that some of the neighborhoods that had the lowest death rates were also low-income Black communities. And what separated these communities that were so resilient from other communities that were not so resilient? And it was one of three things. Neighbors knew each other and weren't afraid of each other and knew who needed help. And so they were able to go and provide the help. There was shared community spaces, commercial spaces where people got to meet each other and get to know each other and really build those ties and networks. And then there were established, well-embedded, trusted community and faith organizations that were able to provide assistance, provide information that people trusted. And so with that in mind, we ask community partners to help us promote community resiliency, help us promote this ethos of being a buddy. And how do you do that? Well, before an emergency even happens, look at your networks and try to identify who are people who are climate susceptible. And that usually means who's older, who's living by themselves, who has certain health challenges, who has disabilities, who has really no one else to help them. Once you find those people, match it with hyperlocal volunteer buddies. Who are people in those very same communities who can be called upon to be volunteers to help keep others safe? And this is all work happening during blue skies when there is an emergency. And how do you connect those climate susceptible residents to the volunteers so that way those relationships are being built among them? So when the volunteer does call during an emergency, it's not someone who they are unfamiliar with. And so again, how can you do it? We spoke a little bit about virtually when an emergency happens, check on family, friends, and neighbors. And COVID has shown us that there are so many different ways now to check on people, whether virtually, by text, phone, visiting. And when you do conduct a wellness check, encourage your clients, your neighbors, your parishioners to use AC, even if only for a couple of hours. Remember, it's that continued added on impact of heat that's the real danger. And if they don't have an air conditioner, we'll help them find a vaccinated family or neighbor with an air conditioner to visit, even if for a couple of hours. Help them find a cooling center or even a cool space. That might be a local mall, that might be, and Target probably hates it when I say it. People can go to Target and get lost there for hours, but it's a cool space to access. Encourage them to drink, wear light, loose clothing, and have them know what the symptoms and signs of heat illness are and be on the lookout for that. And when they see those signs and symptoms, to call for assistance. And we're going to talk very quickly about power outages. As I said, they often happen whenever there's a heat event, and that usually causes several consequences. The loss of air conditioning and what that means for people who are climate and heat susceptible, trying to stay cool. We also see an increased need for ambulances. Chronic health conditions are exacerbated. And in particular, it is dangerous for those people who rely on life-sustaining electrical medical equipment. Now, people who use such equipment, we really encourage them to register with their utility provider. It does one of two things. It lets a utility provider know there is someone who needs electricity here for life-sustaining equipment. And so with that, the utility can send them advance notification of an outage, as well as alerting them there is someone here who needs to have power restored very quickly. And in the meantime, people who use such equipment, we encourage them to have backup equipment, particularly batteries or alternative power sources and communication sources, as well as a place to go while the power is out. And one of the places that often has power and generation are hospital emergency rooms. So in last case scenario, encourage them to go to an ER to have their equipment recharged or access to medical assistance. I think this is one of the last slides, I hope, I'm pretty sure. One of the things that we're asking our partners is to be our advocates for helping to promote climate justice. Our home energy assistance program, that air conditioning program, only provides for air conditioning. Many other states use those funds to help cover utility assistance. And we know in New York City from our surveys and our research that the bill itself is very cost prohibitive, and which discourages people from using air conditioning. So also thinking about how can we no longer see air conditioning as a luxury for those who have the means to own it and use it, but really a life-saving intervention. And with that, we have to think about how we can increase electricity use for some, but also decrease electricity use as a community, so that way we can conserve our grid, as well as thinking how we can decarbonize our city and promote electrification, and how we can promote electrification in an equitable way, whether that's solar energy, wind energy, but really thinking about how everyone can benefit from these mitigation efforts to reduce greenhouse gas emissions, as well as building these hyper local communities, resiliency hubs where people can look out for each other. And NYCHA, New York City Housing Authority, that oversees public housing, is very closely looking at how to build these types of local resiliency hubs that could be sources of help during emergencies, as well as helping with the day-to-day emergencies. And I will skip that. This is just a summary. These are resources. Please visit. You'll find a wealth of information. If your organization hasn't already signed up, I really do encourage you to sign up to the Advanced Warning System. It's a great tool operated by New York City Emergency Management. And with that, opening it to questions and comments.
Thank you so much, Munerah. So the floor is open, and what could I also, and I should have done this at the beginning of the session, ask people to put their name and organization and email in the chat box, so we connect with each other that way. So the floor is open, and let me unmute people or allow participants to unmute themselves.
And we will send these slides out. And Maggie, nice to see you again.
Thank you, Munerah. I will jump in with the first question then, and that is why. It's just incredible to me that the funding runs out for the air conditioning program. And I know that perhaps this is an unanswerable question, but what, Munerah, you talked about advocacy around that issue. How can our sector come together to be effective around that issue?
You know, the advocacy, the budgeting is really determined by Health and Human Services as part of the congressional budget. And many other states use state funding to supplement the home energy assistance program. And so one of the things, we have the power of our voices to advocate with our elected officials, both in DC and in Albany, to really elevate this concern and really bring the equity focus as well as the health impacts together to call for more funding. Unfortunately, there's so much noise for funding, and there's not enough advocates in this world to elevate that need.
Thank you. Go ahead, Maggie.
Hi, good morning. Or good afternoon in New York. I am curious about whether the health department has direct like infographics or information that can be handed to people who, for example, have a mental health condition and are taking medications for that, or who have a substance use condition and are taking medications for that. I'm interested in whether or not those types of materials exist and can be shared so that people are aware of their own health hazards and can take steps to protect themselves.
We have been working on developing guidance on medications, but unfortunately this was pre-COVID, and so with COVID we've sort of fallen behind. With that said, we do have many different infographics, data stories, where we really believe in the power of narrative, as well as access to real-time data and other health data and neighborhood reports on our Climate and Health Hub site, which I'll drop a link in the chat. That really helps people not only get information they need, but also customize it, at least in New York City, to their neighborhood and their address. So I will share that in the link.
Race, go ahead.
Hi, yes, good morning, everyone, and thank you so much for your presentation. Extreme heat and the impacts to faith-based communities is something that I think a lot about, and it's a big challenge. And I agree with much of what you said during the presentation. Some of the practical things that I was just thinking about in terms of my own house of worship that I visit is like, I wonder just if there are things that we can do to make sure that we are keeping our congregants cool and safe, and that we're observant for signs that heat stroke may be occurring or heat exhaustion may be occurring. I was reflecting on some of the things we learned from the speaker from our first webinar that talked about conducting an energy audit for houses of worship. I thought that was particularly interesting because, at least in my experience, on Sunday when I was at a house of worship, it got quite hot, well above that 78 degrees, which we kind of like established as being a benchmark. And I wonder if just doing something as simple as taking a temperature at the height of a service when all of the bodies are in the room, you know, what is the actual temperature of the air in that room? I think that could be really telling, and then help us kind of establish a benchmark for where we need to get to. And maybe, you know, conducting an energy audit and being cognizant of that is like a tangible thing that a faith-based organization can start with. I also was thinking of a house of worship that I recently visited, and they are in a very old building with a very large sanctuary, probably with a capacity of about 500 people, I would assume. And they recently decided to relocate their summer services in a smaller conference room that can accommodate about 50 people. It's much easier to cool, and it was in alignment with the attendance that they are typically seeing at this point in time. So I thought that was just another example of maybe some considerations that faith-based organizations may have if they're having challenges, if they have that opportunity. I realize not all faith-based organizations have the ability to relocate services to a smaller space, but if so, I thought that was an interesting observation and tactic that I've seen a house of worship deploy in an effort to keep the temperature down for their congregation. And then finally, I'll just also mention that FEMA provides, you know, hundreds of $millions across the country for our hazard mitigation grant program, which is administered by FEMA but managed by states. And recently, 501c3 nonprofits were made allowable to write grant applications to access some of that funding. And I would, you know, encourage umbrella faith-based organizations, you know, such as the diocese or such as a, you know, kind of a larger faith-based organization to perhaps initiate conversations with the state of New York to see if their priorities are in line with extreme heat, if there are types of mitigation priorities that they may be willing to support those umbrella faith-based organizations with pursuing, such that they would be able to possibly put it in a grant and disseminate funding for things that would you know, make inroads in terms of mitigating extreme heat for their houses of worship and their congregants. So just wanted to share a few thoughts. I absolutely love your presentation and something that I think a lot about. So thanks for everyone, and thank you for nice being with you this morning.
And just to hop along on some of the things that you mentioned, New York City, we have Electrify NYC that's helping buildings to think about decarbonization, but also in the process, looking at ways to access incentives, tax breaks, grant programs to increase the efficiency of buildings. So I think it's a great resource that is not very well known. And one of the other things, how can faith communities help their congregants. I think one of the things to keep in mind is that when someone dies from heat, it's a silent death. It's behind closed doors. It's that person who's not coming to the service that we worry about. And so really thinking about who are the people whose faces that we don't see during hot days, what might be happening to them at home, and really being the person to reach out. Because it's, you know, sometimes we think that there's going to be someone else who reaches out when oftentimes no one is reaching out. And so I think because there are so many connections to that, faith communities have connections to people that we as government can never connect with. So I think that's really the biggest connection. And I think I shared this with Lucy earlier on. There was a webinar, I think it was actually a female webinar on the impacts of Hurricane Maria in Puerto Rico. And one of the things they found is that after the hurricane, the rates of PTSD among children was much, much lower than anyone anticipated. And one of the things that they attributed to was the strong social fabric. Families, communities, neighbors, faith institutions. Those were buffers before the hurricane. And those were buffers that helped to sustain people and help people recover after the hurricane. So there's also that mental health support that faith communities provide on a day-to-day basis that is immeasurable when the storm hits. And I don't know, Lucy, if you wanted to mention anything more about Electrify NYC or.
No, the other organization is called New York City Accelerator, and they too have grants that would support grappling with extreme heat, including the support for energy audits that Race already mentioned, and green roofs programs, so that they have a whole selection of programs that might be worth looking into. So when we send the follow-up email, I'll include some links to that. And Race, I think your point on the hazard and mitigation grant programs, that's a separate webinar. I think people need to know how to tap into that, and it's fairly new. So thank you for volunteering to help me put together that webinar. I appreciate it. Brenda, go ahead. You're muted, Brenda.
Sorry. Hello again, and thanks for your presentation. I thought your point about trying to do things during blue skies times is important, although for some of us, it seems like we're not having any blue skies times anymore, because if it's not one thing, it's another. And that sort of brings me to my question about the intersection of heat and the methods for trying to deal with heat stress and other health concerns. You know, during COVID, we were really trying to get people to look carefully at their ventilation systems. And one of the things was about how, how viruses can be spread by the ventilation systems. And also the comment that Race made about moving to smaller rooms in order to make them cool, more efficiently cooled, would have other health implications, like exposing people more to other health concerns. So how's the health department, merging those various concerns to provide advice to the faith communities and the public?
During COVID, the issue of ventilation was a very large issue. So one of the things that we did was we examined the impacts and what other scientists were finding. And we issued guidance. What we found is that using an air conditioner in a way where air was recycled from the outside, or there was a break where you open the windows when no one was there, was still safe. And I think this is for COVID, but we as a health department, we sort of have to be looking at the environmental impacts with the certain condition. And as you said, there are no blue sky days. So similarly, when we provided guidance for COVID and air conditioning use, there's going to be another disease that pops up, another issue in the future where we would have to look at that particular condition and look at the environmental risk. That's to say that it will really be case specific, the guidance, but what we do is we position ourselves as the experts in climate. We work with our environmental exposure scientists, as well as our communicable scientists, to try to figure out for this particular condition, what is the safest thing to do. And so what we said before is like using an air conditioner where everyone in the household is vaccinated, that's the safest thing. But if, really it's the combination of air conditioning and vaccination that is the best protection. Now, there are different scenarios, and with those scenarios, maybe we can talk a little bit online, because there's so many different scenarios where the messaging would be different if you are unvaccinated. Again, keeping your distance within a room, but if you're within the same contained pod, I think maybe, Lucy, if there's interest, we can bring in our COVID experts to speak a little bit more about it, because it is beyond my expertise. But we know for now that air conditioners are safe to use, provided we have people who are vaccinated in the room. When people who are not vaccinated are in the room, we encourage people to wear masks, maintain distance, and really stay with your social group. But I think really highlights the importance of vaccination.
See, I think the length of your answer, though,
Yep.
sort of reinforces my concern that the messaging is very confusing to the general public. And
Yeah.
if there were some way of, saying to, putting out like a checklist, people love checklists.
Yeah.
And because, they seem to be counterproductive. What you
Yeah.
do in order to try and inhibit COVID, except for the vaccination, of course, is stuff that would interfere with the cooling in a lot of cases. So that's why I think, especially right now during the summer, while we still have this intersection of pandemics of heat and COVID and now monkeypox,
Yeah.
that something from the Department of Health trying to address both of those things simultaneously would be really helpful to the general public. Thank you.
Yeah, and I love that idea of a checklist. So I'll feed it back to our team to help get that information out. Oh, Maggie?
Hi, I'm on the National NYDIS Steering Committee, which is the organization that kind of works with all the federal agencies to collaborate with the National Oceanic and Atmospheric Administration on heat. We launched a new website on July 26th called heat.gov. So I added that here, even though it's not a New York City resource. I used to work for the New York City Department of Health, though, Munerah, and I also used to work for NYDIS. So I have a strange history. I do want to also mention, though, Race, I'd love to collaborate with you at some point in your prevention work. I'm working with each of the regions. But I think your example wasn't meant to indicate that that was advisable, right? So he was giving an example of something he knows a church did that was, but then Brenda, you brought this really good point. How does that contradict with the situation we're in with regard to the pandemic? So I think that's an excellent question. And in disaster work, a lot of times what this is referred to as cascading impacts and planning around cascading impacts. So for example, when the pandemic happened and started, there was a whole analysis of the New York City plans. I was there at the time to see the cascading impacts of the pandemic on sheltering operations during a hurricane. So I would imagine that there's been some analysis of cascading impacts of the pandemic on cooling centers, because that would make sense. And I would imagine that the heat epidemiologists at the New York City Department of Health have worked on that. So that would be the area where I would look to see what guidance could be developed in a simplified form for other, you know, groups that may be trying to bring people together in a cool space if it's not an official cooling center. So I just wanted to suggest that as a pathway. And I also think for advocacy purposes, it's helpful to know that prolonged heat has not been typically part of the portfolio of emergency management, even though it has had its place in health departments. And so even the mitigation grants, like the BRIC grants, there's still an effort underway to look at to what extent heat emergencies are being included in these various mitigating efforts, or to what extent is heat emergency included in the National Disaster Recovery Framework and revisions to that framework. So there's ongoing conversation in that area. And I would say it really does help when community groups and faith communities and basically stakeholders of every type are applying pressure to include heat. And lastly, I'll just state that people die from heat emergencies when it's not, or heat when it's not a heat emergency. So just the early days of a highly hot, you know, kind of prolonged heat event can be the most deadly. And I think communicating about that has been one of the things that we all in the federal conversations have been trying to figure out, how to make sure that everyone understands that you shouldn't wait until it's a heat emergency warning, because people may be at risk of death even before that. So thank you.
Thanks, Maggie. So it is just about 1 o'clock. So unless we have a final question, and I'm looking for any hands, let me thank our speaker for this wealth of information. We will be sharing her deck as well as some of the links in the chat box as in a follow-up email later this afternoon. And before you peel away, if I could have you just fill out this poll very quickly, and so we can get some feedback on how to make these webinars even stronger. It's certainly the quality of the speakers has been tremendous. So thank you again, Munerah, for joining us, and Hannah, her colleague, for joining us. And our next Lunch and Learn is around emotional and spiritual care for climate anxiety. We know faith communities, the pastoral care that we're providing folks who are grappling with climate anxiety, whether they're youth or folks on the front line or folks who are just grappling with this at an existential level. This is really we'll be looking at some of the tools for religious and lay leaders to support their congregations around that issue. So again, thank you, and please fill out the poll.